So it's interesting. In addition to private investment in higher education, which we've been seeing kind of going in cycles for the last 25 to 30 years in this country, you've got a couple of new entrants. You have HCA, which is primarily a healthcare system that's operating hospitals with their acquisition of the Galen College of Nursing. You have Kaiser Permanente that's publicly announced that they're going through the accreditation steps to open their own College of Medicine to create more MDs that are needed in California. But you also couple that with some of the traditional people that have been out in the space for quite some time. The group that used to be called DeVry, Adtalem now, has completely remade their organization into, primarily a healthcare education group. Their nursing schools, which started as a very modest deaconess college of nursing in the Midwest, about 10 to 12 years ago, has now grown into Chamberlain, which is one of the largest, sort of solution providers to the nursing shortage in the U.S. And you couple that with their MD schools that they own down in the Caribbean, and they're probably the largest publicly traded education group that's focusing on the healthcare problem in the U.S. And then you have private investment. There's a Canadian private equity company, Altus, that bought the St. Augustine School from Laureate down in Florida, which has PA programs in nursing. And then, recently bought the Rocky Vista College of Osteopathic Medicine in Colorado, following a very similar plan to sort of aggregate assets in healthcare training and healthcare education that are focused on those pain points, pun intended, where, we need more doctors, we need more nurses, and we need more those mid to higher level primary care people.